The accident happened on Route 7, 3 miles from the nearest exit. A deer darted across the highway at dusk and I swerved to avoid it. My car spun twice before hitting the guardrail hard enough to deploy the airbags. I sat in the wreckage for maybe 30 seconds, checking myself for injuries. Nothing was broken, but my head throbbed where it had hit the side window. The airbag left my face feeling burned. My hands were shaking so badly I could barely hold my phone. I called my sister Victoria first. She lived 20 minutes away. We weren't particularly close, but she was family, and I was hurt, scared, and not thinking clearly enough to call anyone else. The call went to voicemail. I tried again. Voicemail. Vic, I was in an accident on Route 7. Car totaled. I'm hurt. Please come get me. The message showed as read within seconds. No response. I called again and again. 6 calls in 10 minutes, each one going to voicemail. I could see she was reading my text. The little read receipt mocked me under each increasingly desperate message. Please answer. I need help. Vic, please. I'm bleeding. Why aren't you answering? A state trooper eventually stopped and called me an ambulance. I spent 4 hours in the emergency room getting stitches for the cut on my head and being monitored for a concussion. My phone sat on the hospital tray beside me, silent. Victoria finally called back at 11 that night, 7 hours after my first call. Hey, sorry. I was at dinner with Marcus. Phone was on silent. What's up? I was in a car accident. I called you 17 times. Oh my God. Are you okay? I have a concussion and 8 stitches in my head. I needed you to come get me. I needed help. Well, you're obviously fine now. Why are you being dramatic about it? You got to the hospital, right? So someone helped you. A stranger helped me. You're my sister. You saw my messages and ignored them. I didn't ignore them. I was busy. You can't expect me to drop everything every time you have a problem. I have a life, Hannah. That was 3 years ago. I think about it every time Victoria's name appears on my phone, which isn't often anymore. We exchange texts on birthdays and holidays, see each other at family gatherings where we make polite small talk. But the relationship we had before, whatever thin thread connected us as sisters, snapped that night on Route 7. What Victoria didn't know was that our grandmother had named me trustee of her medical trust 2 years after the accident. Grandma Eleanor had established the trust to ensure her grandchildren would have access to quality health care, regardless of their financial circumstances. $500,000 set aside for medical expenses, properly invested and growing steadily. The conversation had taken place in her living room 6 months before she died. She'd been frail but sharp, her mind still clear as crystal. I'm naming you trustee, Hannah. Not your parents, not Victoria. You. Why me? Because you show up every week for 3 years. You've driven me to appointments, managed my medications, sat with me through chemotherapy. Your sister visited twice in that same period, both times because your mother guilting her into it. He's busy with work. Everyone's busy. You made time. That tells me who can be trusted with responsibility. He squeezed my hand. Besides, I heard about your accident, about the calls Victoria didn't answer. I've been surprised. You knew about that? Your mother told me. Tried to defend Victoria, said she'd been at dinner and didn't hear her phone. But I know the difference between missing calls and ignoring them. Victoria made a choice that night. I'm making one now. Victoria was a beneficiary. So was I. But as trustee, I controlled the approvals. Any medical expense over $50,000 required my signature. Grandma had chosen me because I'd spent her final years visiting weekly, managing her medications and driving her to appointments. She trusted me to make sound decisions about the family's medical care. The trust administrator had explained it carefully when I took over the role. You have discretion here. You're not required to approve every request, but you should have good reasons for denial. Medical necessity, appropriateness of treatment, those kinds of factors. I'd approved one claim so far. My cousin's appendectomy. Straightforward, necessary, no question. Victoria had never needed to use the trust. She was healthy, worked a corporate job with decent insurance, lived a stable life that didn't involve car accidents or emergency rooms. Until now. My phone lit up on a Tuesday evening. Victoria's name. I almost didn't answer, but curiosity got the better of me. Hannah. Her voice strained, higher pitched than normal. I need to talk to you about something important. Okay. I've been having some health issues. Severe pain. Complications. My doctor found a large ovarian cyst. It's complex, potentially dangerous. I need surgery to remove it. I'm sorry. That sounds serious. It is. The surgery is scheduled for next week. But there's a problem. My insurance has a high deductible I haven't met, and they're classifying this as partially elective because it's not an immediate emergency. I need access to Grandma's medical trust. I was quiet for a moment, letting the request settle. How much? The surgery is $85,000. Insurance will cover about $40,000. I need the trust to cover the remaining $45,000. That requires my approval. I know. That's why I'm calling. The hospital needs the signature by Thursday to keep my surgery slot. Can you sign the forms? They're sending them to your email tonight. I'll look at them. Hannah, I need this surgery. The cyst is growing. My doctor says waiting could lead to complications, even ovarian torsion. I could lose the ovary. I understand. I'll review the paperwork. Can't you just say yes now? I'm really stressed about this. I need to know it's handled. I need to see the medical documentation first. That's part of my responsibility as trustee. You're my sister. This should be automatic. The word sister hung in the air between us. I thought about Route 7, about 17 unanswered calls, about being told I was dramatic for needing help. I'll review the paperwork, I repeated. I'll let you know my decision. When? The hospital needs an answer by Thursday morning. Then I'll give them an answer by Thursday morning, Hannah. Wing, and I'm the specialist she needs. Chest X-ray showing bilateral pneumonia. Blood gases showing inadequate oxygenation. This wasn't a mild case. She was genuinely sick. The way I had been genuinely sick 12 years ago. Part of me wanted to feel satisfaction. The poetic justice of the moment wasn't lost on me. But mostly I felt the weight of responsibility. Regardless of our history, she was my patient now, and I had taken an oath. Her room was the third on the left. Through the window I could see her in bed, oxygen mask on, monitors beeping steadily. She looked small, frightened, diminished by hospital equipment and illness. Exactly how I must have looked 12 years ago. I knocked and entered. She turned her head toward the door and I watched recognition dawn in her eyes. First confusion, then shock, then something that might have been fear, shame, or both. Maya. Her voice was muffled by the oxygen mask, weak from the effort of breathing. Dr. Santos, I corrected, pulling up her chart on the room computer. I'm the pulmonologist assigned to your case. You're a doctor? I've been an attending physician here for 3 years, specializing in pulmonary critical care. I began reading her vitals, lab results, and imaging. The pneumonia was extensive, bilateral infiltrates, inflammatory markers through the roof. He was sick. Genuinely, seriously sick. Your oxygen saturation is 84% on 6 liters. That's concerning. I can't breathe, she said, the desperate confession echoing exactly how I had said it 12 years ago. I know, I said. That's respiratory failure. Your lungs aren't exchanging oxygen efficiently because of the infection and inflammation. I made notes in her chart, ordered additional treatments, and adjusted her oxygen delivery. We're going to increase your respiratory support, start aggressive antibiotic therapy, and monitor you closely. If your oxygen requirements increase, we may need to consider intubation. Fear flashed across her face at that word. Intubation, the breathing tube, the ventilator. Will I die? She whispered. Not if I can help it, I assured her. Your condition is serious but treatable. I see much worse outcomes in patients with better initial presentations. I pulled up her chest imaging on the monitor. This is your chest X-ray. See these white areas? That's consolidation, fluid and inflammation where air should be. We need to clear that infection and reduce the inflammation so your lungs can function properly. Maya, I'm scared. Dr. Santos, I said again. In this hospital, I'm Dr. Santos. She closed her eyes. When she opened them, they were wet. I'm sorry for what I said back then. When you told the emergency staff I was seeking attention while I was in respiratory failure. I didn't know. You didn't want to know. There's a difference, I interrupted gently. I finished my documentation. Your nurse will be in shortly with medication adjustments. I'll round on you again in 6 hours. If your breathing worsens at all, Tell the nursing staff immediately. They'll page me. You're really going to be my doctor? I'm the pulmonologist on call and you need a pulmonologist, unless you prefer to wait for someone else to be available. I let that hang in the air. We both knew she couldn't afford to wait. I'm very good at my job, Lauren. I became very good at my job specifically because of what happened to me. Because I know what it's like when people don't take your breathing seriously. She looked at me for a long moment. I really am sorry. That's between you and your conscience. Right now, my concern is your pulmonary function. I headed for the door, then paused. For what it's worth, I don't let personal history affect my medical judgment. You'll get the same standard of care I give every patient, which is excellent care because I take respiratory emergencies very seriously. Someone should have taken mine seriously. Over the next 4 days, I managed Lauren's care with meticulous attention, adjusting her antibiotics based on culture results, monitoring oxygen requirements, consulting infectious disease when her fever persisted, ordering imaging to track progress. She improved slowly. By day 5, she was transferred out of the ICU to the regular medical floor. I saw her once more before discharge during final rounds. You saved my life, she said. I did my job. That's what doctors do. We don't ask if patients deserve saving. We just save them. I didn't let them save you. No, you didn't. And I remember that every single day when I walk into this hospital. I remember what it feels like to not be believed. So I believe my patients. I take respiratory complaints seriously. I don't assume anyone is being dramatic when they say they can't breathe. I told everyone you were exaggerating. For years I told that story like it was funny. I know. I heard about it. I didn't understand what I'd done, not until now. Not until I couldn't breathe and thought I was going to die. I closed her chart. You're being discharged today. Follow up with your primary care physician in 1 week. If you experience any worsening of symptoms, shortness of breath, fever, chest pain, go to the emergency room immediately. Don't wait. Don't assume it's nothing. Respiratory issues can deteriorate quickly. Will I see you again for follow-up? You'll follow up with the outpatient pulmonology clinic. I work primarily in the hospital setting with acute cases. She nodded slowly. Thank you for taking care of me even though I didn't deserve it. Everyone deserves medical care, Lauren. That's the point. That's what you didn't understand 12 years ago. Whether you think someone is being dramatic or not, whether you believe their symptoms are real or not, they deserve evaluation by medical professionals, not dismissal by family members who think they know better. I left her room and continued my rounds, seeing 5 more patients that shift. Each one received my full attention, complete focus, and serious consideration of their symptoms, because I knew what it was like to not be taken seriously. Knew what it felt like to drown in air while someone laughed. Knew the terror of your body failing while people assured you were fine. Lauren was discharged that afternoon. I never saw her again. I heard through hospital staff that she'd followed up appropriately, that her pneumonia had resolved, and that she'd quit smoking after the scare. I don't know if she changed, and I don't particularly care. What I care about is that I became the doctor I needed 12 years ago, the one who believes patients, treats respiratory distress as the emergency it is, and doesn't dismiss gasping and cyanosis as attention-seeking. I'm the doctor who takes breathing seriously, because I remember what happens when nobody else does. My sister learned that lesson in my ICU under my care, breathing oxygen I prescribed, taking medications I ordered. She learned it while depending on my expertise, my training, and my commitment to saving lives regardless of personal history. She learned what I already knew. Breathing is never dramatic when you can't do it, and the person you dismiss today might be the specialist you need tomorrow. I became a pulmonologist because my sister convinced medical staff I was seeking attention during respiratory failure.